Wrist radial deviation. This exercise strengthens the abductor pollicis longus, flexor carpi radialis, extensor carpi radialis longus, and extensor carpi radialis brevis muscles. Use the appropriate forearm position as required by the condition of your client or patient. Wrist radial deviation with forearm in neutral position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Position the forearm in neutral. Secure the resistance band on a heavy object or sturdy surface, or step on one end of the band with one foot on the same side of the wrist being strengthened. Grab and pull the band, bringing the hand upward. You may stabilize by holding down the forearm with the opposite hand. Control the movement as you go back to the original position. Wrist radial deviation with forearm in pronated position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. If not participating in the activity, the opposite hand may stabilize by holding down the forearm. Note on the video that the direction of the resistance should come from opposite the direction of the movement. Position the forearm in pronation. Secure the resistance band against the wall or sturdy surface. Grab and pull the band, bringing the hand inward. Be mindful that the elbow joint does not engage in the activity. If not participating in the activity, the opposite hand may stabilize by holding down the forearm. Wrist radial deviation with forearm in supinated position. Sit upright on a chair with an armrest. You may use a side table as armrest as alternative. For better isolation of the movement, tuck your elbow near your side and bend it to 90 degrees flexion. Note on the video the direction of the resistance should come from opposite the direction of the movement. Position the forearm in supination. Secure the resistance band against the wall or sturdy surface, or hold one end of the band with the opposite hand. Grab and pull the band, bringing the hand outward. Control the movement as you go back to the original position. Be mindful that the elbow joint does not engage in the activity. Choose the right color of the band for the needed resistance.